Are you living with COPD and looking for ways to manage your symptoms more effectively? Understanding your medication is key to better breathing and a higher quality of life. Today, we're diving deep into Breztri Aerosphere, a powerful tool in the fight against chronic obstructive pulmonary disease. Breztri Aerosphere is a prescription inhalation aerosol designed for the long-term treatment of chronic obstructive pulmonary disease, COPD, in adults. It's a unique combination inhaler, bringing together 3 different medicines in one device. This triple therapy approach helps manage COPD symptoms comprehensively. COPD is a chronic lung disease that includes conditions like chronic bronchitis and emphysema. Breztri is specifically approved for adults with COPD and is not intended for asthma treatment. Clinical trials have not been conducted in people with asthma. The 3 active ingredients in Breztri Aerosphere are budesonide, Glycopyrrolate, and Formoterol Fumarate. Each component plays a distinct role in improving your breathing. This combination works synergistically to open airways and reduce inflammation. Breztri gained FDA approval on July 23, 2020, offering a new option for COPD management. It's important to remember that Breztri is a maintenance medication. It is not for relieving sudden breathing problems and will not replace your rescue inhaler. Let's explore how each of Breztri's 3 components contributes to better breathing. First, budesonide is an inhaled corticosteroid, ICS. It works by decreasing inflammation in your lungs, which is a common cause of breathing difficulties in COPD. Reducing this inflammation helps keep your airways more open. Next, Glycopyrrolate is an anticholinergic medicine. It blocks the effects of a natural chemical called acetylcholine in your lungs. This action allows the muscles around your airways to relax and widen, making it easier for air to flow in and out. This relaxation helps to alleviate tightness in your chest. Finally, Formoterol Fumarate is a long-acting beta-2 adrenergic agonist, LABA. This medicine works by activating specific receptors in the smooth muscle cells of your airways. This activation also causes the airways to relax and widen, further improving airflow. Formoterol provides a long-lasting effect, typically for 12 hours or more, ensuring sustained symptom relief throughout the day. Using Breztri Aerosphere correctly is crucial for its effectiveness. You should use 2 inhalations twice a day, typically once in the morning and once in the evening. Do not take more than 2 inhalations twice daily. Always read the step-by-step instructions provided with your prescription. Your healthcare provider should also teach you how to use the inhaler properly. Consistent and correct use ensures you receive the full benefits of the medication. It is vital to understand that Breztri Aerosphere does not relieve sudden breathing problems. Always carry a rescue inhaler, such as albuterol, for immediate relief. If your breathing problems worsen or your rescue inhaler isn't working as well, contact your healthcare provider immediately. After each dose, 2 puffs, rinse your mouth with water and spit it out. Do not swallow the water. This simple step helps prevent a fungal infection in your mouth and throat, commonly known as thrush. If you miss a dose, take it as soon as you remember. However, do not take more than 1 dose to make up for a forgotten dose. Simply take your next dose at the usual time. If you accidentally take too much Breztri or experience unusual symptoms like worsening shortness of breath or chest pain, seek immediate medical attention. Do not spray Breztri Aerosphere into your eyes. If it accidentally gets into your eyes, rinse them thoroughly with water. If redness persists, contact your healthcare provider. Also, do not use other medicines that contain a LABA or an anticholinergic unless specifically instructed by your doctor. Like all medications, Breztri Aerosphere can cause side effects. Many of these are mild and manageable. The most common side effects include upper respiratory tract infection, pneumonia, and back pain. You might also experience thrush in your mouth and throat, which is why rinsing your mouth after use is so important. Other common side effects can include joint pain, flu-like symptoms, headache, and high blood sugar levels. Muscle spasms, cough, and inflammation of the sinuses are also reported. Some individuals may experience diarrhea, hoarseness, or symptoms of a urinary tract infection, such as painful and frequent urination. Nausea, difficulty sleeping, feeling anxious, and awareness of your heart beating, palpitations, are also possible. Always tell your healthcare provider about any side effect that bothers you or does not go away. While less common, Breztri Aerosphere can cause serious side effects that require immediate attention. Fungal infections in your mouth or throat, thrush, can become serious if not managed. Remember to rinse your mouth thoroughly after each use. People with COPD have a higher chance of getting pneumonia, and Breztri Aerosphere may increase this risk. Watch for symptoms like increased mucus production, changes in mucus color, fever, chills, increased cough, or increased breathing problems. Contact your healthcare provider if you notice these signs. Breztri may weaken your immune system, making it harder to fight infections. It can also lead to reduced adrenal function, a condition where your adrenal glands don't produce enough steroid hormones. This can be particularly risky if you are transitioning from oral corticosteroid medicines. Symptoms include feeling tired, lack of energy, weakness, nausea, vomiting, and low blood pressure. Sudden breathing problems immediately after inhaling your medicine are a serious concern. If this happens, stop using Breztri and call your healthcare provider right away. Serious allergic reactions, including rash, hives, swelling of your face, mouth, or tongue, and breathing problems, also require immediate medical care. Breztri may affect your heart, potentially causing increased blood pressure, a fast or irregular heartbeat, or chest pain. It can also affect your nervous system, leading to tremor or increased anxiety. Report these symptoms to your doctor immediately. Long-term use may lead to bone thinning or weakness, osteoporosis. New or worsened eye problems, including acute narrow-angle glaucoma and cataracts, are also possible. Symptoms of acute narrow-angle glaucoma include eye pain, blurred vision, seeing halos around lights, or red eyes. If you experience these, call your healthcare provider right away. Urinary retention, characterized by difficulty urinating, frequent urination, painful urination, or a weak stream, can also occur. If you experience these symptoms, stop Breztri and contact your doctor immediately. Changes in blood values, such as high blood sugar, hyperglycemia, and low potassium, hypokalemia, have also been reported. Low potassium can cause muscle spasms, weakness, or abnormal heart rhythm. Before starting Breztri Aerosphere, it's essential to discuss your complete medical history with your healthcare provider. Do not use Breztri if you are allergic to budesonide, glycopyrrolate, Formoterol, or any other ingredients in the inhaler. Breztri is not for use in children, as its safety and effectiveness in this age group have not been established. Tell your doctor if you have heart problems, high blood pressure, seizures, or thyroid problems. Inform them if you have diabetes, liver or kidney problems, or weak bones, osteoporosis. Any immune system problems or exposure to chickenpox or measles should also be disclosed. If you have eye problems like glaucoma or cataracts or prostate or bladder problems, Breztri may worsen these conditions. It's also important to tell your doctor if you have any viral, bacterial, parasitic, or fungal infections. If you are pregnant or plan to become pregnant, discuss this with your healthcare provider. It is not known if Breztri Aerosphere may harm your unborn baby. Similarly, if you are breastfeeding, talk to your doctor about whether Breztri is safe for you and your baby. Always provide your healthcare provider with a complete list of all medicines you take, including prescription and over-the-counter drugs, vitamins, and herbal supplements. Breztri Aerosphere can interact with certain other medicines, potentially causing serious side effects. Specifically, tell your doctor if you are taking other anticholinergics like tiotropium or umeclidinium, or other LABAs like salmeterol or vilanterol. Atropine, antifungal medicines, or anti-HIV medicines can also interact with Breztri. Breztri should not be used with other combination inhalers such as Trelegy. However, it can be used with rescue inhalers like albuterol. Keeping an updated list of your medications is crucial for your safety.